changes to neuroanatomy of mice. I'm a student from McMaster University, but I took on this project at the Mouse Imaging Center in Toronto, Ontario, under the supervision of Dr. Brian Nye. Brian and I are interested in this project based on what has been observed in treating pediatric cancer patients with brain tumors. In the past 30 or so, the good news is, in the past 30 or so years, we've become very good at treating this disease. Our combination of chemotherapy, cranioradiotherapy, and surgical options have allowed up to 75% of these patients to live well into their adult years. The unfortunate part is, as these patients live into their adult years, the existence of late effects has become more evident. Late effects are side effects of treatment, which persist well after treatment has ended, and have been largely implicated on the cranioradiotherapy portion of treatment. Late effects could include lowered socioeconomic status, less chance of finishing school, less chance of getting your education, and more. So the question we have now is, what is leading to these late effects? What is physically changing within the brain that is leading to these behavioral difficulties? And we'd like to answer this question using mice. To understand why we can use mice, first we need to understand that anatomy and behavior are tied together. They're individual anatomical regions within the brain which are associated with various behavioral and cognitive functions. So in this picture of the human brain, you see there are regions that we know are associated with motor control, vision, sensory processing, and more. At the Mouse Imaging Center, we have access to mouse anatomy through high-resolution MRI imaging to the point where 90% of the behavioral mutants studied at the Mouse Imaging Center were found to have imaging abnormalities. With that in mind, we embarked on a study where we wanted to use a mouse model to understand the anatomical differences induced by cranial radiation. We wanted to radiate the mice in their infancy and track their growth throughout time, mimicking what a human pediatric patient might experience. So the timeline of our study is shown on the right. Our first imaging time session came when the mice were 2 weeks of age. This is about the time when they begin to open their eyes. We then irradiated them at an infant equivalent age of 2.5 weeks. Our next imaging time session came at 3.5 weeks of age. This is a couple days after we weaned the mice, or in other words, take them away from their mothers. Our next imaging time session came in their adolescence at about 6 weeks, with a couple more at 9 and at 14 weeks. After the 14-week imaging time point, the mice are sacrificed and their brains kept for an ex vivo scan, a higher resolution ex vivo scan to be performed another day. Using this longitudinal imaging data, what we wanted to do is to ask questions about whether the changes in volume observed within our population are due to dose. We also want to ask whether the growth rate of the mice in our population are affected by the dose that they received in their infancy. So our radiation procedure is a relatively simple one. The mice are anesthetized with ketamine, and their brains placed within a lead shield. But their heads are left exposed to a full dose. The mice receive one of 4 radiation doses, either 0, 3, 5, or 7 gray of radiation, where gray is a unit of measure of the energy per weight deposited into the mouse. These numbers are scaled from the numbers that a human pediatric patient might experience as part of the treatment protocol. As mentioned before, our imaging modality is MRI imaging. And at the Mouse Imaging Center, we have access to high-throughput multi-mouse MRI imaging with our 7-Tesla MR scanner. And as well, we can image about 7 mice in about an hour and a half. And these images are taken in vivo. The mice are asleep during the procedure, and afterwards can be taken out of the machine, placed into the cage to be imaged, irradiated, or otherwise handled on another day. Turning your attention to an image we might pull from our scanner. This is a 2-dimensional slice of the 3-dimensional data set that we acquired. You can see that there are many details of the mouse anatomy within our field of view. On the left, you see the neck and the spinal cord, and on the right, you can faintly make out the nose and mouth. But the big bright object in the middle of the screen is the brain. Even within the brain, you can pick out individual anatomical details. The olfactory bulbs, as I've outlined in red, are particularly detailed. This is a structure known to be, as the name implies, associated with the perception of olfactory cues. The dentate gyrus, which is implicated in learning and memory of the mice, is also particularly detailed, as I've outlined in green. Now, to understand what we do with these images, I'm going to put you in a position where we have all of our imaging data, or at least a large subset. These images represent a population of mice at various ages having experienced various radiation doses, with within these images holds the key to understanding the effect of radiation on the developing brain. And the way we pull them out is using a process known as image registration. We take each individual image and we rotate it, we twist it, and we tweeze it until we can put all the individual images on top of each other and make a nice clean consensus average. Then we take a step back and ask, what do we have to do to each individual group to have them conform to that consensus average? Did we have to pull on the olfactory bulbs because they were too small? Or did we have to push on the back of the brain because it was too large in another group? And from these deformative details, we come up with a vector field where at each individual voxel, where a voxel is a volumetric pixel, the magnitude and direction of that voxel indicates what it had to do in that individual brain to conform to that average. And from these deformation details, we can begin asking questions about the effective dose. And also, because we have longitudinal imaging data, images taken over time, we can ask questions about how the mouse is growing within our study. And on the next slide, that's what I'm going to try and show you. So this plot shows the size of the olfactory bulbs, average for mice which receive 0 gray of radiation, and plotted over time. So on the x-axis is the age of the mouse. Notice that there are five points on the curve corresponding to the 5 imaging time points that we took at 2, 3.5, 6, 9, and 14 weeks. On the y-axis is the size of the structure, which we deduced from our deformative details, and afterwards I scaled to the size of the mouse at 2 weeks in order to eliminate within mouse differences present at birth. And in the last four points on this plot are fit with an exponential growth curve, but the first two I connected simply with a straight line for a reason that will become clear in a moment. And this curve represents mice which receive 0 gray of radiation. But what does it look like for mice which receive the dose? So now the green line on the screen indicates this average size of the same structure for mice which receive 3 gray of radiation. Notice that every point after their radiation is now smaller relative to the 0 gray. This exponential growth curve appears to be going to a lower asymptote. And the line connected, and there is a greater difference in the way the mouse grows between the 2 and 3.5 D imaging points. This is an effect called the post-radiation step. There is a similar story to be told for the 5 gray mice in blue and the 7 gray mice in purple. Each individual curve seems to be going to a lower asymptote as a function of dose, and the post-radiation step is more severe. There are plenty of details with this growth model that we need to examine, but for the simplicity of this talk, I'm going to take a linear approximation to this growth data, where now we only have one parameter that we're interested in, the slope of that line, which is a rough approximation for the growth rate of the mouse in our study. And we begin asking harder questions about how the mouse grows as a function of dose. We don't need to ask this for a large average structure such as the olfactory bulb. We can ask this for each individual voxel, which is again a volumetric pixel within our brain images. And on the next screen, that's what I'm going to show you. So here is the brain image representative of the average of our population. And overlaid on top of it is a color map indicating regions of the brain where the growth rate changes significantly as a function of dose, where threshold for high statistical significance, where red is greater significance than 5. So there are two structures which immediately jump out as being significant. The dentate gyrus, as shown by axial slice A, which again is implicated in learning and memory, appears to be very effective. And the olfactory bulbs also come out again in this linear model. This is good news for us because this is one of our goals of the study, was to understand how growth rate, which regions of the brain is the growth rate affected by dose. It's also good news for us because we're not terribly surprised by these results. These two regions that I've identified, the olfactory bulbs and the dentate gyrus, are regions of the brain where neurogenesis, or the growth of new neurons, occurs well into adulthood. So it makes sense that the growth rate would drop if in their infancy we went and used our radiation to kill off a bunch of the neural progenitors, which would be providing new neural cells all throughout the mouse's life. So this is interesting for us, but we're not done there. We're going to shore up our study with more imaging data, and we're also going to begin to do behavioral testing to further connect the anatomical details we see with our MRI to the behavioral aspect of late effects. We're also going to formalize our model. I used a linear approximation to get us some interesting growth rate results, but we want more information than that. We would like to begin asking questions about how the severity of the post-irradiation step at each voxel, and maybe some of the parameters of its curve at each voxel. We need to formulate this in a very concise model and provide a more detailed, accurate color map such as this, highlighting the radiation sensitive regions of the brain. And of course, all in all, what we'd like to do is to hope that our understanding of the radiation sensitive regions of the brain will help guide treatment protocols for pediatric patients in the future. Thank you.
I'm just curious, why on your looks like third measurement, why is the error bar so much larger on that one on the green?
That's because there was a scan that when I was running the registration, I just outright missed it. So there's a very low sample size at that, simply as a mistake.
Oh.
When you radiate the venous what, I guess you compare the time when you do that to a human age or something,
Yeah.
so it's pretty. So you had radiation for 2.5 weeks or something. Is that comparable to?
Yeah, it's hard to aim to say that 2.5 weeks is associated with the exact age in humans, but what they say is it's infant equivalent. They grow much faster than humans.
What's limiting your ability to image more frequently during the most's life?
It's not, they are living creatures and it is a bit of a stressor on them. We don't want too many imaging points to affect their growth. We want to just take snapshots.
Any plans on doing this with actual human patients? Because bringing them back after they received treatment to image them? Do you guys do that?
We don't do that. We're the mouse